Hey there, this is Robert, and today we're going to take a look at a story that popped up earlier in the week out of Costa Rica, and it's about a Naegleria fowleri case that was reported in a young man in the country. And this is a Google translated from Spanish to English press release from the Costa Rica Ministry of Health that describes the case. And this, other than a couple media reports, this is the most comprehensive report we've had so far. And this came out on January 7th, and it says a 15-year-old boy was affected by Naegleria fowleri, a microorganism commonly present in temperate, fresh water anywhere in the world. The young man, who presents the clinical picture of primary amoebic meningitis, remains in a delicate state at the Liberia hospital. So, according to this press release at the time, the boy was still alive. I haven't been able to find any official updates on his current status as of January 11th. The investigation of the case by the experts in health determines that apparently the young man acquired the amoeba by inhaling water in the thermal springs of Guayabo de Bagaces. I don't know if I pronounced that right. Since said microorganism commonly inhabits this type of water. Then at the bottom it says, in the history of Costa Rica, only 2 cases have been registered. And the first case is a minor, and it was an American back in 2014. So if you follow this YouTube page or the website outbreaknewstoday.com, you're probably already familiar with that case in 2014. And that was the unfortunate death of Jordan Smelsky in 2014. And if you want to learn more about Jordan's story, I interview his dad, Steve Smelsky, and I'll link to it below so you can check it out. He talks very candidly about the whole situation, their trip to Costa Rica, and Jordan's progression and finally his death. So I encourage you to check that out if you want to learn more about that and learn more about the Jordan Smelsky Foundation. Very, very good place to donate your time and your money or whatever for this cause to educate the world, the public, about Naegleria fowleri. So what is Naegleria fowleri? Well, it's an amoeba, right? It's a single-celled parasite that's found in warm, fresh water. It's also free-living, so it doesn't have to have a host. It can just be in the environment without being present in a host. Where is it found? Well, it's found in bodies of warm, fresh water like lakes and rivers. It's also found in geothermal water such as hot springs, much like where this Costa Rican boy probably contracted it. Warm water discharge from industrial plants, geothermal naturally hot drinking water sources. It can be found in tap water, as we've seen in some cases out of Louisiana. Swimming pools that are poorly maintained or not well chlorinated or unchlorinated, that's also a risk factor. Water heaters, it can be found in the soil, but unlike other types of organisms, it cannot be found in salt water. So you're not going to find this in the ocean, for example. How is it contracted? Well, Naegleria fowleri infects people when water containing the amoeba enters the body through the nose. You can't get it by swallowing it. It's not going to happen that way. It has to rush up through the nose. And this typically occurs when people go swimming or diving in warm freshwater places like lakes and rivers. The parasite travels up the nose to the brain where it destroys the brain tissue. The initial symptoms of primary amoebic meningoencephalitis, the name of the disease itself, start at about 5 days with a range of 1 to 9 days after infection. In the early stages, symptoms are very similar to other types of bacterial meningitis, right? Headache and fever and nausea and vomiting. Later symptoms can include stiff neck and confusion, lack of attention to people and surroundings, loss of balance, seizures, and hallucinations. After the start of symptoms, the disease progresses rapidly and usually causes death within about 5 days, with a range of about 1 day to 12 days. And it kills by destroying brain tissue, causing swelling. How common is it in the U.S.? Well, from 1962 to 2018, there was 145 infections in this country. And I don't remember the exact number from last year, 2019, but there was at least a couple, I believe. I know there was one out of Texas and maybe one out of California. I don't recall 100%. But as you can see on this map, Florida and Texas and some of the other southern tier states have seen the most cases. Now, in the 10 years from 2009 to 2018, 34 infections were reported in the U.S. Of those 34 cases, 30 people were infected by recreational water, right? Swimming, diving, water skiing, that kind of stuff. 3 people were infected after performing nasal irrigation using contaminated tap water, right? There were some cases out of Louisiana, people using neti pots with tap water who died from the amoeba that was found in the tap water. And then there was one case of a boy that contracted it as water rushed up his nose when he was using the slip and slide in his backyard while tap water was used on the slip and slide. Now, the infections have primarily occurred in the southern tier states of the U.S., as I mentioned earlier, but infections have been documented up in Minnesota at least twice in 2010 and 2012, and some other northern states. We've seen them up in Maryland and some other places like that. So it's not strictly a thing of the southern states. And its infections have been reported all around the world. And I have a map of Pakistan here because Pakistan reports quite a number of cases each year, at least in the past several years. And I think in 2019 they saw at least 15 cases / fatalities in Karachi alone. So Pakistan, I've seen cases in Vietnam reported in some other countries. So they do get reported in some places. It's probably much more common than we expect. They just maybe are not catching it in some of these countries. Well, the fatality rate is pretty high. It's at least 97%. And since 1962, only 4 people in the U.S. have survived Naegleria fowleri infection. And the survivor from 1978 many people are saying that this is because it was a less virulent strain. Then it took 35 years until the next one, and that was in 2013, where 2 children, survived the parasite, and then another survived it in 2016. Now, the lab diagnosis, it's a little difficult. You have to know that you're looking for it, right? You have to, if you go to the physician or the ER and you have a headache, one thing you must mention to the physician is that you've had exposure to fresh water, so they can even consider this. Some of the hospitals here in Florida are quite good at this, but some other places they may not be up to snuff as much. So primary amoebic meningoencephalitis and Naegleria fowleri infection can be diagnosed in the laboratory by detecting the actual organism in the CSF, in a biopsy or tissue specimens, by detecting the nucleic acid in the same anatomical sites, or detecting the antigen in the CSF biopsy or tissue specimens. And below, I'm going to go ahead and put a link to an interview I had with a medical technologist who detected this in a patient. I believe it was in Florida. And you can hear what she has to say about the laboratory diagnosis and just the stress of finding this and having to report it to the physician. So look down below if you want to check that out. Now, there's also some assays they're working on, the CDC, And they're looking at some point-of-care portable assays called the LAMP assay, the Loop-Mediated Isothermal Amplification Assay. It requires no special equipment. It's simple to test, easy to read. It's quick and reproducible, and you get a result in about an hour. And they say that the sensitivity specificity is the same as real-time PCR. So we'll be keeping an eye out for that, in the future. Now, the treatment for Naegleria, I used to say this in articles back, maybe 8-10 years ago, that it was mostly unsuccessful, right? But things have changed a little bit in recent years. And it's typically a cocktail of different drugs, antifungals, antibiotics. Then there's the investigational breast cancer and anti-leishmania drug miltefosine, which has shown promise with a combination of other drugs. And we'll talk about that in a moment. Miltefosine has shown amoeba-killing activity against Naegleria and other free-living amoeba in the laboratory, like Balamuthia, for example. And another part of the treatment that has assisted in some way is the cooling of the body of the patient. Okay, let's look at the last 3 survivors in the U.S. And like I said, after 35 years, from 1978 to 2013, Kaylee Hardig, she was 12 years old at the time, from Arkansas, survived Naegleria fowleri. So she was the first one in 35 years. She was diagnosed with PAM approximately 30 hours after becoming ill and was started with the recommended treatment within 36 hours. She also received the investigational drug miltefosine, and her brain swelling was aggressively managed with treatments that included cooling the body below normal body temperature. It's called therapeutic hypothermia. Kaylee made a full neurologic recovery and returned to school, and I imagine she's about an adult right now. And her recovery has been attributed to early diagnosis and treatment and the novel therapeutics that included miltefosine and hypothermia. And that was right around July of 2013. And several months later, there was a second child. His name is Abel Rodriguez, 8-year-old boy at the time. He's considered a PAM survivor, although he did suffer what is likely to be permanent brain damage. He's also blind in one eye and disabled. Now, he was also treated with miltefosine, but was diagnosed and treated several days after his symptoms began. And remember, this is a very progressively rapid type of infection, and diagnosis and treatment is of the utmost importance to save somebody's life. Now, the cooling of the body below normal body temperature was not used in Abel's case. Then the most recent survivor was Sebastian De Leon, and this was a case in Florida in the summer of 2016. The 16-year-old was reported as the 4th U.S. PAM survivor. He was diagnosed within hours of presentation to the hospital and was treated with the same protocol used for Kaylee Hardig in 2013. He also made a full neurologic recovery and returned to school. And if you look below, I'm going to go ahead and put an interview I did with the physician that treated Sebastian in the Orlando hospital. And it's really an amazing story, and you're going to want to hear it, of the treatment of this young man. Fascinating stuff. Now, I've talked about miltefosine several times in this video, and the trade name is called Impavido. And ever since these survivors started popping up, a lot of it has been attributed to Impavido or miltefosine. And the company, Profunda, based out of Orlando, offers this drug to hospitals to keep on hand in their emergency rooms, free of cost, unless, of course, you use it. Just because, because of the importance of starting treatment rapidly, it's not always wise to wait for the shipment to arrive to your hospital. So here I listed about 22. I'm not sure if it's more than that now. This is kind of recent. At least 22 hospitals have taken up on this miltefosine program. And as you can see, a lot of them are out of Texas and Florida and other states that have actually reported cases of Naegleria fowleri. And the last thing I want to talk about is prevention. If you're nasal rinsing, if you're going to do nasal rinsing, neti pots or anything like that, make sure you use distilled or sterile water, which you can buy in the stores. And the label will state either distilled or sterile. You can also boil or cool the tap water, boil and cool tap water for about 3 to 5 minutes and cool until it's lukewarm. Previously boiled water can be stored in a clean, closed container for use within 24 hours if you're going to nasal rinse. And the other thing I just want to mention real quick is in the Islamic religion, they do nasal rinsing as part of the religious practice called ablution. And I suspect that's linked to a lot of these cases, say in Pakistan. So it would be the same thing in that case, using sterile or distilled water and not tap water. Anyway, so we have a case in Costa Rica, the second case ever. And I'll be keeping an eye out to find out the status of the patient. And when I do find out, I will definitely at least publish it on the website outbreaknewstoday.com. And again, I want to encourage you to check out these other videos below. They're very, very interesting, and you're going to really learn a lot concerning the treatment and the diagnosis and some of the other information. And that's it. That's a wrap for this video. I'm glad you could watch it. I hope you enjoyed it. Please comment below, share it with your friends, subscribe to the channel, like this video, and I'll see you next time on Outbreak News TV.